everyone, welcome to our adventure safety follow-up video sponsored by Mammut.
First, let's meet our incredible partner for this event.
We at the Lady Alliance want to give a huge thank you to our partner Mammut for helping us orchestrate this event.
Mammut is a leading Swiss-born premium outdoor and safety-based brand bringing centuries of expertise in the climb, hike, ski, camp, and travel industries to outdoor participants.
Their aim is to provide opportunities for women to find empowerment through adventure and each other.
Though our tour is now done, we wanted to ensure that you had access to this important safety information so that you can watch this 1 hour refresher anytime you'd like.
Plus, there is one more incredible thing to note.
Usually with our tours, all of our tickets purchased are donated to our nonprofit partner of the year. But this year with COVID, it's really changed the game.
If you are able to at this time, all donations linked above go to the nonprofit partner Power to Be,
an organization that empowers people living with a disability or barrier to access adventures rooted in nature.
Okay, without further ado, let's dive into our incredible safety refresher.
This 1 hour online wilderness first aid refresher will help you build a plethora of skills during this community-focused immersive experience. Our instructor today is from Rocky Mountain Adventure Medicine, and her name is Alanna Thompson. Enjoy!
Hi everyone, I'm really excited to be here and going to get right into talking about trail first aid. Some things that hopefully won't, but probably will happen to you if you're hiking a lot or climbing or spending a lot of time in the backcountry. Fortunately for us, most of the first aid that we do, you probably know this from trips you've done already and things you've seen, most of the first aid we do is pretty simple. We don't do a lot of gory, dramatic stuff because we don't have a lot of mechanism of injury for that. So, lucky for us, we get to focus on stuff that is more common and also not as severe as you might be worried about. We're going to talk first about the kinds of things that go around an incident. Most of the time when you're talking about wilderness medicine, we tend to focus in on the actual first aid of it, but it's often not just first aid. In fact, it's almost never just first aid. We usually have a whole variety of things surrounding us that we need to deal with. And this is what we talk about in incident response. So we've got 9 steps, and we'll just look at this slide that shows what those 9 steps look like. We call this breaking the cycle. And we're going to start down at the bottom with pre-trip planning. Those are a couple of steps, pre-trip planning and trip or activity management. We want to do those before we get any incidents and really before we get out on the trip and then as we're getting going. So for pre-trip planning, we usually break this down when we talk about it in classes. We usually break this down in terms of the who, what, where, when, and why of trip planning. And all of those things are really valid to think through. Really what you want to do is imagine the worst case scenario. Obviously, we don't want to spend too much time on worst case scenarios, but you want to think, what are the possible things that could happen to me? And if they did, what would I want to have with me? And what knowledge would I want to have? So this kind of thing that you're doing now, starting to check out a wilderness first aid, really empowering, will really help you to feel more safe in your trips and better able to plan. We like to say that a really good pre-trip plan allows for an excellent response. So take a look through all of those things. We could spend a really long time on this. Usually this presentation takes me about an hour to do just these 9 steps, but we're going to do it in just a few minutes. Once you've done some good planning, you get out on the trip with your favorite buddies or your family or whoever it is you're going to travel with. The next thing you want to think about is managing that trip really well. This is self-leadership, it's group leadership, and it is much easier said than it is done. This is stuff like making sure you're drinking water before you start to feel really thirsty, making sure that you're keeping your calories up so that you've got sugars and proteins and fats to respond to what's going on around you, changing your layers to keep the right temperature, dealing with a little blister before it becomes a huge, annoying, giant blister. And all of these things, again, easier said than done. I'm a head down kind of person. I like to get on a trip and get where I'm going, and I certainly enjoy the journey to some extent, but I'm not really great at stopping to deal with things that probably should be dealt with. So I still learn from my friends on this who are better at managing their own trips and their own activities. So if you pre-trip well and you manage your activities well, hopefully you don't have any major incidents. But if you do have an incident, because sometimes they just happen, we want to be able to prepare for them, or we want to be able to respond to them really well. So then we'd be up into the yellow numbers there that go up from hazard and group management all the way up to food. We're starting with the most important step. You have to manage your hazards well. And I'm sure you've heard people talk about this before. You don't want to become another patient. If you're dealing with helping somebody, and most of us do have this instinct to help, that's probably why you're interested in learning about trips and hiking and first aid and trying to get better at those kind of issues. You're probably somebody who likes to help. But make sure you've managed those hazards well before you enter the scene and try to stabilize somebody else. Some hazards are easily managed by you. Some hazards are going to need professionals to come in to help us, and knowing the difference there and not overcommitting ourselves to dangerous situations is really vital. But once we have a safe scene, then we can go in and deal with the first aid. So like I've already said, this is usually pretty simple. Of course, it can get complex, but most of the time the first aid is fairly simply dealt with. This is another area where we need to know whether we need to get help from somebody else. Do we need the pros in to help deal with this injury, or is it something we can stabilize and deal with ourselves? Once we've got the first aid done, we'd move on to providing some kind of shelter for our patient. And that shelter should start with the patient themselves. So think about the clothing layers that they're wearing. If we can get them into warm, dry layers next to their skin, that's a great first step. And a lot of times you would think that people would look after this for themselves, but I can tell you from my personal experience, both being a patient and helping other people, patients tend to be, it's not that we're dumb when we're injured, but we have other things to think about. So we might not be focused on, oh, I got to zip up this zipper or pull my toque down or, get my mitts out of my backpack because my hands are starting to get really cold. So take a look at your patient, assume they're colder than you are, and help them with those layers. Then think about the environment around you and how many people are going to need shelter. If you're traveling in a group of 4 people and one person's injured and you've got a really blustery, nasty day with, snow or rain coming sideways and a lot of wind, everyone's going to need shelter, because sitting still in the backcountry is very different from being active and moving and keeping your body warm. So you might need to look at sheltering for everybody in the group, or maybe you're just talking about sheltering that one person and everyone else can keep themselves warm. But think about that. You want to conserve heat instead of have to regenerate that heat or create it afterwards. Once you've got sheltering dealt with, you can talk about signaling. And by this, we mean getting help. Again, sometimes you don't even need it. You can deal with the whole situation yourself. But if you do need to get some help, then you might need to have some way to attract people's attention to you or to let people know that you do need help. So this might be something you carry like a GPS messaging device, or it might be, maybe you've got good cell coverage where you are and you've got your phone with you. Maybe you have to track down another hiker or another climber, send them out to get help, or maybe you're actually going to go out yourself. That gets a lot more complex, but it's something we've been doing for generations, going out to get help when we need it. Once you've got that established, you've got help on the way if you need it. You want to think about stabilizing your scene for the next however many hours. You might be 4 or 6 hours before someone can get into you, depending on how remote you got. So think about providing some heat, either through getting a fire started if it's safe and if you know how to do that. And I got to say, if you know how to light a fire in the backcountry, you become the outdoor guru for everyone you travel with. It's like, I call it your woods cred, right? It's kind of like street cred, but it's for the forest. If you can get that fire going, people tend to listen to what you tell them to do because they trust your leadership, and that makes a group much easier to manage. Plus, it's really fun. So if you can learn safely how to make fires in the backcountry and how to get them going in marginal conditions, that's a huge help to you. But some people choose to carry an emergency stove instead, or maybe you're going to be up above tree line and you're going to have something other than lighting a fire to keep people warm. So if you need to provide heat, then you want to look for some source of that. The next things you want to look at are water and food. Of the two, water is much more important. You can last quite a long time without food, but you can't last that long without water. And when we're dehydrated, we respond more poorly to incidents. We're not going to heal as well. We're not going to adapt as well. And actually, we're dumber when we're dehydrated. That one is actually just, we're dumber. If you are 1% dehydrated, you can lose 5% of your mental acuity. So most of us are dehydrated all the time. And then if you get into an emergency situation, getting somebody hydrated again can be a huge help. So focus on that one first. We really want to be delivering clean water. So you might need to be carrying something with you to treat water that you find in the backcountry. And after that's settled, then you can go and provide some calories, and probably you're looking at fast calories like sugars. That'll be really easy for people to absorb. That also makes everybody super happy. If you carry a pocket full of candy that people can munch on in an emergency situation, people will like you more and you'll be safer. Okay, so there's our breaking the cycle. That's our 9 steps. We can talk now about common incidents that we might see in the backcountry. So, as I was already saying, we don't do a lot of really gnarly stuff. We don't do a lot of blood squirting everywhere or bones sticking out of the body. What we do a lot of is these typical first aid injuries. And this list actually comes from a study that was done for people leaving national park systems in the States and being surveyed as they were leaving to see what injuries or incidents they had. And these are the most common ones. So soft tissue injuries, we're talking about blisters, cuts, scrapes, simple stuff. The next things would be sprains and strains, so damage to joints, but not a fracture. The next one would be extremity fractures. So we're probably talking about wrist and ankle, usually a closed fracture, meaning there's not really bad cuts associated with them. They don't have bones sticking out. And they're usually fairly in line. There's not a lot of weird angles sticking out of the body that don't belong there. After that, you might have environmental problems like getting too hot or too cold. And then after that would be exacerbation of pre-existing medical conditions. We might not have a lot of time to get to those last 2. They're pretty long and really interesting discussions. What I will say quickly about getting too hot or too cold is this is something you want to manage as soon as you possibly can. When you notice yourself starting to get too cold or starting to get too warm, it's time to deal with it then instead of waiting until it becomes significant. And interestingly, one of the biggest predictors is behavioral or mood changes. People tend to get really grumpy when they're getting too cold or too hot. So watch for that, in addition to people expressing that they feel too cold or too hot, or maybe changes in what their skin looks like. In both of these cases, our skin tends to go pale, whether we're getting too cold or too hot. At the start of those continuums, we're going to go pale, our heart rate's going to go up a little bit. So those are some warning signs. Stop and deal with those right away. And your best tools are getting people into a different environment. So warmer, drier clothes, or cooler and into the shade, and actually getting people hydrated. We adapt to heat or to cold much better when we're hydrated. So those are a couple of tips that you can think about there. Really proactively manage those. Having the right layers and good gear with you really makes a big difference there too. And then for exacerbation of pre-existing medical conditions, this is as varied as the medical conditions that are out there. And it might be something serious like heart attack or stroke, or something manageable, but that could become serious like diabetes or a seizure disorder. So for now, let me just say, if you or someone that you travel with has a medical condition, if being in the wilderness might make it more difficult to manage or might compromise that person's health, do a really good job of learning about that before you get out with them. Ask good questions. And learn things like, what are the warning signs that you're starting to deteriorate in this condition, and what should I do for you in those circumstances? And then have a think about how much more important it is to be able to get help coming to you if you do have a serious medical condition. Okay, so there's our typical issues. I'm sure you can imagine those happening to you or someone you know, or maybe you've seen it before. Maybe you've seen all of that before. We're going to start with talking about blisters. And sometimes blisters are just a super minor problem. And in this slide that's up here, you can see a really big blister that a friend of mine got. This is what happens when you go hiking with me. You get yourself injured and then you make it into my slideshows. But we'll start with a different method of treating blisters from this one, and we'll get back to this one at the end, because there are a couple of ways that you can think about treating blisters. First, understanding what a blister is, and you can see it there in that image, that big fluid-filled pocket. It actually is the body protecting the tissue underneath it. It's created by friction, and that fluid is supposed to protect the tissue underneath it from getting any more damage, but it is an injury to the skin and it hurts. I'm sure you've experienced blisters before. When you think about preventing blisters, this is where we really want to start. We can treat them, and we can treat them really well, but better off to prevent them. So when you think about prevention, the very first thing you want to do is get really good quality and really good fitting footwear. So whether that's your climbing shoe or your hiking boot or something in between that, get a pro to help you fit it. Get a really good quality hiking sock to go along with that if it's going to be hiking you're doing, and then take some time to break it in. Don't buy a brand new pair of boots and go on an epic trip. Again, my own experience dictates that this is not a good idea. You will get some pretty big blisters from that, and it can really ruin a trip, especially if they then rupture and get infected. So I'm going to show you a couple of ways of treating that. But just before we get in there, have a discussion with the people you travel with about different ways that people prevent these things. There's a few basic methods for this. One of the prevention mechanisms would be reducing the friction that exists between your foot and the sock by wearing two socks. So you might have a liner sock, a very, very thin and snug sock, and then a thicker sock over top. I've talked to people who've had really good success using a pantyhose type sock, like really thin, really tight stays put on the foot. And that means that the friction is going to happen between those two socks instead of between the sock and your foot. That'll reduce the friction. The other thing would be pre-taping. If you know you're prone to blisters, especially when you're breaking in a new pair of footwear, get some tape on your skin when it's nice and dry. Your skin is nice and dry because the tape will stay put a lot better. Another method would be lubing your foot. You can use an anti-chafing lube like runners use, and that you'll still get some friction there, but the friction won't create as much damage. So I've got a prop I'm going to bring on screen here. I want to, first of all, apologize for the relative goriness of this prop. Usually we use this to deal with much more traumatic injuries. I've tried to cover the more gnarly sections of it, but here's my foot. And there's a blister on there I made with makeup. Hopefully you can see that there on the side of the heel. And I'm going to show you a couple of methods to deal with this, and then we'll go back to those images because that image shows a really good way of dealing with blisters. You've got basically two methods. Either you're going to use moleskin, or you're going to use some kind of blister pad that's like a squishy pad that goes on top of the blister. Moleskin never goes on top of the blister. The idea with moleskin is we want to create protective walls around the blister so that the friction happens now between the boot or the sock and the moleskin instead of the blister itself. So you take your moleskin, and moleskin often comes in a big long sheet. I've cut a little square of it here. It's got adhesive backing on the back and it's nice and soft on the top. And I've cut this square that's about the right size to cover over this blister. But again, if we just stick this right over top of the blister, it's just going to increase the pressure and make this problem worse. The other thing that we would do with this is we would trim our edges so that we end up with nicely rounded corners so that there's less for your sock to pick up and try and pull away. So kind of like a cooking show, I've already prepped where I want to go with this. I've got my moleskin donut. And this is what we would do. We would round all of the edges of this. And then we would also cut a hole right in the center of it that's the size of the blister. And the way I do that is I just fold the moleskin over and take my scissors and cut a little donut hole in the middle there. And then I would hold that up to the blister and make sure it was the right size and do a little bit more trimming until I got it exactly how I wanted it. So this one is exactly how I want it. And I'd be slipping it right over top of the blister so that it's covering over both sides. You just peel off the adhesive back on this and stick it right to the skin. If you can get the adhesive backing off. There we go. And we'll stick that right around the blister. The drier your skin is, the better it's going to stick. And the next thing you want to do is take a look at this from the side. So if I hold that up to the lens of the camera, hopefully you can see that the blister is actually still sticking up over the top of the moleskin. This isn't going to work unless I can get the moleskin higher than the blister itself. So I would just continue this. I would put another donut on top of this one until I was sure that the moleskin was protecting the blister by being taller than it, basically. Once that's done, I would then go and take this onto the foot. The moleskin is adhesive, but I've found that typically just with the amount of sweat you get inside your hiking boot, it's going to start to deteriorate the skin underneath, and this will start to lift up. And eventually you'll end up with a little folded piece of moleskin inside your hiking boot in addition to your blister, which isn't really going to be helpful. So a couple of ways you can tape this. I like to go, this might seem a little bit overkill, but it works to keep the adhesive on the foot, is I tape like a stirrup from the center of the foot right over top of the blister padding. Remember that moleskin is up higher than than the foot is, all the way around the other side. And I'd take some time to smooth down these edges so that they weren't getting all folded. This foot is kind of an awkward shape, so it's a bit hard to do. It can be hard on real people's feet too, but you want to take a little bit of time to get that. And then to really lock this down, you can put another strip of tape around the foot, holding those ends of tape down so that they're really not going to lift up. I was on a trip once, on a backpacking trip, and I got a blister on my heel, and I used the other method that we'll show you in the images. And I did just a couple of strips. So I had 2 strips going this way and 2 strips going this way. And I left it on for the duration of the backpacking trip. It was on for 5 days. My blister actually disappeared underneath the dressing, and I was pain-free the whole time. So if we can take a look at those images, I'll show you, this is just a slightly different method for handling this. So in this case, you can see that the dressing is going directly on top of the blister. It's a little pad of a product called Mepitel. And Mepitel is actually a burn dressing, but it works really well for blisters. It's very, very thin. It's sticky. It's actually antibiotic. So you can leave it on the wound itself for up to 10 days. As long as there's nothing else going on, you're not feeling any signs of infection, the dressing can actually stay on there. Surprisingly, for how thin it is, it works really well at diverting the pressure off the blister. So you can see how big that blister is on my friend's foot. It casts its own shadow, that blister. This is a serious blister. But with one little strip of Mepitel over top, the idea here is that when the pressure hits the blister, the squishy padding of the Mepitel is going to divert the pressure out to the side and take the pressure off the blister. You can also use second skin pads for this, or there's a variety of blister bandages that you can just, it's got the adhesive backing, just like a regular Band-Aid, but it's got a squishy pad in the middle. And then my friend has taped her foot. You can see a couple of stirrups and a couple of anchor straps. And she's done a really good job of keeping it nice and snug there. So it worked really well to keep her pain-free as well. Even with the size of that blister, she was able to hike the rest of that trip without any pain. And the blister was healthy and clean underneath, and we didn't have to worry about dealing with that. One more thing on blisters, and then we're going to move on to some wounds, is you can lance a blister. The idea of lancing a blister is to poke a little hole in it and let the fluid out. It's remarkably satisfying to do. A lot of people find it creepy, but it really is great to get that fluid out of there. My rule of thumb for treating blisters is if I can treat it with the wound closed, the blister intact, I will. If I can't treat it with the wound intact because it's too big or it's in an awkward spot, then I will clean the site really well. I'll clean whatever sharp tool I'm going to use to poke the skin of the blister, like a safety pin or something like that. Poke it, get the fluid out, and then treat it in one of the ways that we've already talked about. But it can make your treatment a little bit easier, especially if the blister is enormous. Okay, we could talk about blisters also for hours and hours. And if you get talking to people, sometimes people get really heated about their blister methods. This is the best way to do it, and I've been doing it this way for years. And it doesn't matter which way you use, as long as you find something that works for you. And I do encourage you, if you're a blister-prone person, try out some of these techniques. Talk to other people about it and keep trying something that will work, because once you get a method that works, it really changes the way your trip goes most of the time. Okay, so moving on to some other wounds we're going to talk about. The next slide will show you 4 goals for wound care. The first goal is to stop the bleeding. Usually this is pretty easily accomplished. The best way to do this is with direct pressure. So if you had a lot of bleeding going on, in your hand, and you could grab some gauze and hold that directly to the hand. Keep some pressure there. Keep it on for 5 minutes probably. Really important is whatever dressing you put on the hand first, that layer that's touching the tissue, the body's going to try and clot within that gauze that you're putting on there. And this is why we say don't remove that first layer until the bleeding has stopped. The first clot is the strongest. After that, your body has to work hard at making clotting factor again. So if you press this on here and you did it for 30 seconds and then you're like, oh, I wonder if the bleeding stopped, and you pull that off again, probably you're still going to be bleeding. So just have some patience, put something clean on, and just hold it there until the bleeding has stopped. Now, once the bleeding has stopped, this dressing absolutely has to come off so we can clean the wound. So the goal is get that on there, stop the bleeding, and then pull it off. We should be able to do this within 5 or 10 minutes of getting this wound. If you're having a difficult time pulling it off, then soak it in water first, and then it should come off a little bit easier. But we do need to get that off, because our next goal is to clean it and keep it clean. The best thing to clean wounds with is clean water, clean enough to drink. You don't have to use soap, and you don't have to, and actually shouldn't, use alcohol or hydrogen peroxide or iodine or any other chemical cleaning product. It is incredibly effective at cleaning the wound, but it also slows down the body's ability to respond to that. It'll make it take longer for your body to heal because you're reducing the health of the good tissue. So clean water, and hopefully you've got lots of that available to you. And you can go ahead and get those wounds nice and clean. And I'll show you that when I talk about a couple of these wounds specifically. And then the other things we want to do is promote healing and preserve functionality. So these are things like getting things stitched if they need to be stitched, getting them stitched pretty quickly. The best window for stitching is within an hour. That can be pretty difficult to accomplish if we're a long ways away on our trips. But 4 to 6 hours is kind of the window for getting something stitched. And the cleaner the wound is, the more likely that you will get it stitched if your time is delayed. If you're getting close to that 6-hour mark and you've got a really dirty wound, a hospital might not want to stitch it up because then they're stitching pathogens right in there, bacteria, all the stuff from the dirt that's in there. But if you've cleaned it really well, they might take the chance of stitching it a little bit later on. Our rule of thumb for stitching wounds is if you can't keep it closed in the field, it needs to go out and get stitched. The same wound to your arm that you can keep immobile, or the back of your leg on your calf that you're using to move around all the time, that same wound might need stitching on the calf where it wouldn't necessarily need it on the arm. So give it a try of closing it, and if it works, great, and if not, then you're going to have to get that person out or yourself out to get that dealt with. But promoting healing, things like watching for infection, keeping wounds really clean, getting them out on time to get assessed or cleaned if we need them to. All of these things work in there. Same with preserving functionality. This would be things like paying attention to hands and feet, which have a lot more complex structures in them when we injure them, making sure that we've bandaged things so that you don't want someone's hand all bandaged up in like a fist and leave it there for a week while the muscles start to deteriorate and start to get really stiff in their hand. So it's just things like that we think about with wounds. Okay. We're now going to get back into our gory props. I was making these wounds earlier in my house and kind of freaking my kid out with them. But so here's our gory abrasion, this is a laceration. So a laceration is like a knife slice. It's deep. It tends to have fairly smooth edges, and it tends to bleed really well. Which probably means that it's going to be cleaner than some other wounds we might see out in the backcountry. But a laceration is really common. You could do this with the edge of your knife, an axe, a ski edge, a sharp rock, a sharp stick. This one I tried to think about if someone tripped and fell and put their hand out to catch their fall, maybe they'd get a cut like this. So there's some blood coming down the side, and we've got a little bit of a jagged cut in there. This is a really creepy looking hand. So first thing we need to do here is stop the bleeding. So I would want to get some gloves on if this wasn't my own hand. And as I'm using both my hands to treat, it's definitely not my own hand. So I'd want to get some gloves on so I can protect myself from this person's blood getting into my system. I'd grab some gauze and I'd press that gauze directly onto the wound. Or I could even have the person press the gauze directly onto the wound if I need my hands for other things like managing all the other factors involved in this incident. And we'd keep this here for enough time that we could tell that the bleeding has stopped. And the way to tell the bleeding has stopped is take your pressure off just gently and see whether you get blood gushing through your gauze. If you do, put some more gauze on top, press harder. You'll probably get that wound to slow down pretty quickly. A wound like this shouldn't take us more than about 5 minutes to get stopped unless the person's got other conditions. So then at this point, I would want to peel back the gauze and take a look at the wound itself. Oh, good. The bleeding stopped. I could clean up their hand a little bit, get some blood off the other side. And then, of course, when I'm discarding this tissue, this gauze that I've used, don't just drop it on the ground or stick it in your backpack, your pocket or something like that. You really want to get this in a plastic bag that you can take out and dispose of properly. So we get our biohazards dealt with appropriately, and then we take a look at cleaning this. So, like we said, the best way to clean is with clean water. And a really good way to clean lacerations is with a syringe. You might see a syringe like this hanging out in your first aid kit. Looks like a needle, but it doesn't have a sharp end on it. And its purpose is for cleaning. If we're going to clean a laceration, we really want to run the water down the wound instead of trying to blast the water straight down into the wound. That's just going to push more pathogens down in there. So we'd run the water down the wound like this. I've got a towel down on my table to collect the fake bloody water here. And you would want something to collect that water with. And we would just keep running water down here until we ended up with a wound that was really nice and clean. Once we got to that point, we got a nice clean wound, then we can take a look at it, see how deep it is, see if there's any structures that we need to, well, we're not going to fix them, but structures that need to get fixed in there. We need to dry it off. We're not going to get anything to stick to it in terms of keeping it clean if we can't dry it off. So we need more gauze to come in and dry this off with. And then the idea would be to close the edges of this wound so that they come together and heal really well. You can think about a laceration like it's a canyon. If you've got a really deep V canyon, like that a river would carve in rock, we want to make sure that the canyon edges, the walls of that canyon, can touch each other all the way up so that the wound actually heals from the bottom all the way up to the top. So what we'll often say is draw the edges of the wound together. And on a shallow wound, no problem. Take the edges of the wound, draw it together. It'll bring the rest of the wound in with it. If you've got a really deep gaping wound, you might need to draw those edges in, close them, tape them, and then maybe wrap with something that gives a little bit of pressure just to encourage the walls of the tissue to stay with each other. I've got some pre-done tape here as well, so I'm going to show you what it would look like to tape this. You'll notice I've removed my glove. Not the safest process, but it's really difficult to tape with a glove on. So I would assess, is the bleeding stopped? And if I have no cuts on my hand and their bleeding is stopped, I would consider this a safe wound to deal with without one glove on. But if this is still bleeding, then for sure I'm going to keep my gloves on and just do the best I can with my gloves on. But basically we would take these little strips of tape and we would tape from one side of this wound to the other, trying to draw the edges of the wound together so that the wound is nice and closed. I'm going to cheat and push those together a little bit because this Play-Doh doesn't work super well with this. Actual tissue does work really well with this type of tape. And I'll show you what I'm using here in a minute. So I would tape across from both sides, making sure that it's nice and snug. I'm drawing those edges together, and the edges of the wound are touching really well. You'll also notice that as I'm closing this wound here, I'm leaving little gaps in between each strip of tape because I don't want to cover over that whole area. If it is a little bit dirty still, some infection starts to go on in there, I want anything nasty to be able to work its way out. So leaving those little gaps there really allows us to do that a little bit better. Once I've got it closed, my wound care is basically done, but I do need to make sure to keep it clean. And especially if you're out on a longer trip or this person's going to use their hand, we really want to make sure we cover this up. So I like to use a non-stick gauze for this. So a non-adherent gauze pad. It's still absorbent, but it's got a treating on it so that it's less likely to adhere to the tissue. So it's nice and smooth, kind of silky on the outside. And I've cut a piece that would be exactly the size I want for this wound. And then I would tape this in place. You can just use the transport tape that I'll show you in a second for this, or another option might be roller gauze. Roller gauze is just gauze rolled up in a tube. It's nice and stretchy. I like it because it'll handle kind of weirder parts of the body. Sometimes tape doesn't stick on very well, but I could give this person a little bit of a wrap to hold that gauze down. I just want to leave people's thumbs free if you're going to wrap something like this. You wouldn't even necessarily have to use the whole roller. Our goal is just to keep that in place, keep it covered, keep it clean. So it's going to work fairly well for this poor lonely hand to keep this wound clean and hopefully mean that it doesn't get infected and we can continue on our trip possibly. Now, the nice thing about this is I can just pull this wound right off and replace it with another wound. So that would be lacerations. And just while I'm getting this wound off here, I'll talk just quickly about the products I used there. So I used a tape that's called Transport. It's made by 3M, and it's probably seen this before. It's a little bit porous, so the idea is that it'll allow a little bit of moisture to pass through. I don't know how well it does that, but it is great for wound care. It really sticks nicely to the skin. You can see it stuck to my thumb there. You can also tear it really nicely into long, thin strips. So that's all I did is I took a piece, ripped a piece off, and then I tore it into the strips that I want it, the size I want to deal with wound closure. So Transport is nice because it's really versatile. It's tape, you can use it on all kinds of parts of the body, and you can rip it really small. The downside to it is that it's not sterile. It doesn't come in a sterile package. If you keep this in your first aid kit and it's not dropping onto the ground and getting dirty, it should probably still be pretty clean. But if you did want something sterile, you could go to steri strips. So steri strips are basically sterile, thin strips of tape that you can pull off and use for wound closure, just like you would have used the tape, but it's just a sterile product instead. It's also a lot more expensive if you're going to carry steri strips for all your wounds, but it is the best way to keep your wounds completely clean, is to use steri strips for that. So one of the other injuries that we tend to get in the backcountry is abrasions. And abrasions are a little bit different than lacerations in that they happen when we scratch our body on something. Like we fall and put our hand out to catch our fall, and we end up sliding our hand across a gravel road or a rock or pavement. It's commonly called road rash. So just sticking the abrasion to the hand. Here's a big nasty abrasion on this person's palm. So they have fallen forward, put their hand out to catch their fall, and given themselves a whole bunch of scrapes. What tends to happen with abrasions is we don't just have surface scrapes, we have these gross flaps that stick up that sometimes get dirt or rocks or nasty bits in underneath them. And the big risk with abrasions is that they can get infected because they're so dirty. If we don't get them really clean, they tend to get infected, and that can be dangerous for the patient later on. If you've ever experienced road rash, you know how painful this is to clean. The best way to get these clean is scrubbing them, and that hurts a lot. Another really good way to get them clean is to start by soaking them first and then irrigating them a lot so that we would eventually get all of these little chunks of dirt out here. That's a little bit nicer to your patient. So I usually start with soaking this. You could take a pad of gauze, soak it in water, and then you could put it on top of the wound. Just doing this here on camera, we're not going to be able to get this clean in the few minutes that we have. But if I soaked this and put a little bit of pressure on here so that the water soaks in, when your skin gets wet, it deteriorates the health of it, makes it looser. And so dirt will come out a little bit more easily. So sometimes I will soak this for somebody and then I'll go to irrigating it just like I was irrigating the abrasion. So you can see I've got a little bit of dirt off of there. Mostly what I've got there is blood. So you can kind of dab at it a little bit, especially if you really like your patient. If you don't like them so much, then maybe you're happier to just go straight to scrubbing. And then I could go to irrigating again, like I was doing with the laceration cut, to try and get the dirt off of there. And this might take a while. If you're comfortable scrubbing, or your patient is comfortable scrubbing, then you can soak a pad of gauze like this, hand it to them, and they can give it a really good scrub. It's going to hurt when they do it, but it actually causes the wound to start bleeding a little bit again and pushing that dirt and tissue out, or the dirt and rocks and like balled up chunks of dead skin that are now crammed into their abrasion. So whatever you do need to get this really clean. If you're on a day trip and you're headed home to have a hot shower at the end of the day, the best way to get an abrasion clean is to sit in your hot shower and let the water run over that. But if that's not a luxury you've got on the trip you're on, or you're going to be out for a long time, do take the time to get these clean, even if that means it's going to be really painful for your patient. With abrasions, there's usually not a lot of cuts that need to be closed, or there's not a lot of tissue left to close them. So usually we just cover them over with something nonstick. So again, I would take my nonstick gauze, and in this case, I might use some triple antibiotic ointment. So this is like a polysporin. We at Rocky Mountain Adventure Medicine, we use this in little individual packets because it's we don't get them contaminated as easily that way. And also you can use a smaller amount. So usually we would say, don't put polysporin or triple antibiotic on a wound unless you see signs of infection, because this too, it's good for preventing infection, but it actually blocks oxygen from getting to the tissue. So if you don't need it, it'll slow down your body's healing. It'll take longer to heal your wounds. But if you do need it, then it's definitely worth using. It's very helpful. And in this case, because everything sticks to an abrasion, and abrasions are pretty messy and pretty dirty, and they're likely to get infected, I take a little bit of this and I spread it in a thin layer across the surface of my nonstick gauze. So this is going to make this less likely to adhere to the wound. And then I'm going to put the nonstick gauze right over top of my wound, so it's covering as much of the wound as possible. And then again, I need to keep this covered. I need to make sure it's not going to slide around or uncover the wound. So my favorite tool for this is Tegaderm. And Tegaderm, exactly what you get put on if you get an IV done at the hospital and they put that stretchy clear film over your IV port. That's exactly what Tegaderm is. And the reason I like it is because it's clear, so I can see what's going on inside the dressing. It's sticky, so it's going to stick right to the patient's skin, but it doesn't adhere to the wound. The body won't try to absorb this. So I would put this on right over top of my abrasion and peel off the backing, sticking it down as I go. And then what I'll end up with here is hopefully a nice clean non-stick pad that's been coated with polysporin or something of the like, and then covered over with Tegaderm so that it stays nice and clean and I can keep assessing it from the outside. The problem that you'll find with abrasions is they tend to seep for quite a long time. So even though you've done a really good job of cleaning it and covering it with something non-stick, the plasma that seeps out of that wound is just going to continue to seep. And eventually this pad will get saturated with like a yellowish looking fluid. It's time to change that out. You can't leave that on there or it'll keep getting infected. So we pull the Tegaderm off, we pull the pad off, change that out, and then keep that wound nice and clean. What you're seeing on the outside is the blood makeup on my gloves that's gotten onto the outside of the Tegaderm. So it looks like it's actually still dirty, but it's actually on the outside there. Put that off. Okay, so apologies for those gross props, but hopefully that was a good demo of how you might deal with a wound that you would find in the backcountry. Now, I'm going to take a little aside to talk about ticks quickly. So ticks, I guess they technically fit into our wound process, but ticks are a growing concern in Western Canada. We definitely have them in all the provinces of Western Canada, not very far north. No ticks in the Northwest Territories, for example, but it is a big concern for us here. And we do have ticks that carry diseases here, including Lyme disease. One of the things that's been really confusing in terms of managing Lyme is the tick that carries Lyme is not endemic to Alberta, for example. It is endemic to some other provinces around us. But in our particular area, it's been quite complicated because the tick is present here because it comes in on birds or deer or sheep or human travelers or dogs. And then it lives out the rest of its life cycle here. So despite not being born here, it's still present and you can get diseases from them. Lyme is very complicated. It's really tragic. It can be a lifelong complication if you don't catch it early, but it is curable if you catch it within the first 2 weeks of transmission. So that's why I wanted to talk quickly about ticks. You want to watch out for mysterious symptoms. You might see things like flu-like symptoms, muscle weakness, joint pain, headache, nausea and vomiting is pretty common, but it can affect a lot of other things. Our testing all across Canada is pretty problematic. And so if you go to get a Lyme test and it comes back negative, it might unfortunately not mean that you don't have Lyme. I just really encourage people, if they know they've been bitten by a tick, or if they suspect they've been bitten by a tick, or were in an area where they saw lots of, if they develop any kind of weird or mysterious symptoms later on, it's worth going to get that checked out. And that actually applies in terms of being able to get Lyme from ticks all across Western Canada and certainly all across the States as well. So if you do get a tick that bites you, there is one really proven way to remove it. And so I've got my tick tweezers here. I wanted to show you these very nice, long, very sharp tick tweezers. They're great to have in your first aid kit. They work great for digging out slivers as well, but this is what you want to use for a tick. There's lots of other ways that you might see described to remove ticks, but there's only one method that has been proven to not transmit disease. It doesn't mean that other methods might not be safe, but we haven't proven that yet. It's definitely not safe to burn a tick, smother it with Vaseline, or try to drown it in water. It will get the tick to come out, but those methods have all been shown to increase the likelihood of disease transmission, which is what we're trying to avoid. So you've got some tweezers like this, and then this next slide will show us the way we want to look at getting the tick. Basically, what you want to do is lift up the tick that's attached to your skin, get your tweezers as close to the head of the tick as you can. Squeeze really, really hard at the head. So you're squeezing the tick's head as hard as you can with your tweezers. And then you're going to pull back gently, allowing your skin to tense. So while you're pulling back on the, I don't know if you can see that, while you're pulling back on the skin, you should see the skin start to tent like this. And then you want to allow the tick to let go on its own. So squeeze the tick hard, but pull back on it gently. And it might take it a minute or two to work its way out or to let go, because it actually has a really powerful mouth with these sharp little barbs on it that like to stay in your tissue, but it will eventually come out. Once you get it out, take a look to see that you got the whole tick out of the wound, clean the wound really well, keep the tick, because they can study the tick to see whether it has any diseases or bacteria present in it. And then monitor your patient, or if it's yourself or your kid or someone you travel with, monitor for any kind of weird development of symptoms. Certainly if you get a rash around the bite site, that's very indicative of Lyme. Okay, that's where I'm going to leave ticks. I highly encourage you to check out the Lyme Canada Foundation website in order to get better information on ticks, and that'll be easy to find good information all across different regions. If you're in the States or other parts, certainly the CDC website is really, really good for ticks and prevention, the different kind of repellents you can use. So do educate yourself about ticks. We don't need to be terrified of them. They're solvable. They're a solvable problem. But unfortunately, people are getting diseases from them, and that has been, in some cases, pretty tragic. Okay, we're going to leave ticks there. We're going to go on to sprains and simple fractures before we finish up here. So how to tell the difference between those two things. Sprains or strains are going to happen at a joint. It really doesn't matter whether you know whether it's a sprain or a strain in the backcountry. They pretty much look the same at the joint that you're talking about. And they have a slightly different mechanism or way of getting them than a fracture does. So if you come across somebody sitting on the side of the trail and they're telling you that their ankle hurts and you go to take a look at it, ask them some questions about how they received the injury. A sprain is likely to be forcing the joint into a motion it doesn't like, but not with a traumatic force. If you step in a hole in a weird way and your ankle goes to the side, and you feel that stretch, or you hear a pop along the side of the ankle, you're probably talking about a sprain. If you take a climbing fall and hit your foot against a rock or the edge of a cliff, it could sprain, but you have to be really suspicious of that, because that's a better mechanism for a fracture, hitting something really hard on something. The other things that tend to indicate that it might be a sprain would be swelling that happens really quickly. So by the time you get the person's shoe off, the ankle's pretty huge. And bruising that happens really quickly. They should be able to walk on it if it's their ankle. They might hurt them, but they would say, yeah, I could probably walk on it. Most of the time people don't walk on a fracture. They'll also describe that the pain is everywhere in the joint. So it doesn't just hurt in one spot, it kind of aches everywhere. Those are all really good indications that you're talking about a sprain. So if that's the case, if you've got a sprain, you can treat it with a pretty simple ankle wrap. And the same process we've been using for acute care for sprains for a long time, which is rest it, ice it, compress it, and elevate it. They shouldn't walk on it. If they have to walk on it to get out of a dangerous situation in the backcountry, they might have to, but typically speaking, we don't want them walking on it. We want it rested, and we want it wrapped so that we're reducing the swelling that's going on there and reducing tissue damage. So I'm going to show you this on my gross foot again. You would take a tensor bandage. You've got a couple of options for this. A tensor is really common. Tensor usually comes with those little metal clips on it, which I usually take off and get rid of because they just end up falling off, or I stab myself on them and I don't like it. So I usually just tuck my tensor ends underneath or tape them with really strong tape. But starting near the toes and wrapping towards the heart is recommended so that you're encouraging blood flow to go back towards the heart. What's happening in this sprain is you've got a whole bunch of pooling of blood in the area, and that blood is there for a reason. The blood is there to bring healing agents to the wounded tissue, but we don't want the blood to stay there. So I started near the toes. I'm just wrapping around the foot, give a couple of figure eights around the ankle, and continue wrapping as far off the ankle as they feel like they need pressure. This person kind of runs out of ankle pretty quick here, so I have to stop there. And it's a nice smooth wrap. They might be able to get a shoe or a boot on over top of this if they need to, but otherwise you're gonna let this stay. You're gonna let this person rest and keep this on here. Talk to them about it, ask them how it's feeling. They'll probably start to feel a little bit tingly and a little bit cool in their toes. This might create a little bit of throbbing pressure through here. If that's really uncomfortable for somebody, just unwrap it and do it again. It's fine to let it off. I've sprained my ankle a lot, and I can tell you that when I leave it wrapped and I'm icing it really regularly, my foot is freezing cold all the time. But you do want to talk to your patient about that, or if this is you, pay attention to those. If it starts to become unbearable, it's too tight. So unwrap it, give it a few minutes to warm up again, and then rewrap it and just wrap it a little bit looser. This person should see a physiotherapist. That's beyond the protocol of a first aider, but this injury can be really difficult to heal. So once you've got it dealt with, you want to go out and make sure that they get some follow-up care. So if it's not a sprain, if it's a joint injury that you suspect might be fractured, there's a couple of indicators that it might be fractured instead of just sprained. So again, thinking about the way in which the injury happened can be helpful for this. If the person took a tumbling fall and they hit their ankle really hard on a rock or a log or a branch, it might be fractured. If they heard a crack or a snap or a crunch, it's probably fractured. If they have fractured, they probably won't want to walk on it. They'll tell you, I couldn't walk on it. I'm not going to try, but I definitely couldn't walk on it. It's way too painful, or I can't keep my balance because my foot feels really wobbly. Those can all be indicators of a fracture. You might also see weird lumps, like there's a bone poking up against the skin. So all of those are indicators that there might be a fracture there. If you're looking at an ankle injury and you're not sure whether it is a sprain or a fracture, assume it's a fracture and treat it like a fracture. But if you're really confident it's a sprain, you can go ahead and treat it like I just showed you. What you want to do if someone has fractured something in the backcountry, in the wilderness, is take a look at the actual site. So take a look at the fracture. You know, if they're saying it hurts really right here on the side of my ankle, maybe there's a lump poking up against the skin there. Take a look at it right down to the skin level. So take their boot off, take their sock off, get a good look at it. You want to check for a couple of things. First of all, is there a bone sticking out? Hopefully not. Is there a really big, nasty cut across the top of where they're saying the pain is? If either of those two things exist, we assume that a bone poked out and is either still out or has gone back in again. We call that an open fracture. That wound needs to be cleaned really well, and this person needs to get to the hospital more quickly than someone with a closed fracture, because infection that sets in there is really dangerous for them. Infection to the bone can take a very long time to heal. The other thing that you really want to check is whether they have circulation before that, below where that break is. Most of the time people do, but it is possible that the bones displaced disrupted something in the circulation or the nerve innervation to the rest of the foot. So take a look at the tissue. Does it look the same color as the other foot? Can they feel you squeeze their toe? Ask them if they could move their toes. You don't have to make them do it, but say, do you think you could? And we're trying to establish that yes, there is still blood flowing down below the foot, and they still have nerves that are intact down there. If they don't, this person again needs to get out quickly. The sooner we get them to hospital, the better. Your tissue doesn't live healthily without blood. So this is kind of like our stitching window. In that 4 to 6 hours, we really need to get people to hospital in order for them to keep this tissue healthy. So let's assume it's a closed fracture. So there's no bone sticking out, there's no bad cut there, and they do have circulation. They can tell you their foot still feels warm. You can tell it's a good color. Maybe you can even find a pulse point down here if you know how to do that. Now what we want to do is go and stabilize it so that it's not flopping around and doing more damage. And the stabilizing is also going to cause a lot of pain relief for the person. So the idea here is a splint. The best way to do a splint is to think about immobilizing and reducing the motion in the structure below where the break is and in the structure above, imaginary structure above here. You can do this in a variety of ways. Carrying something with you in your kit to splint with is awesome. You can improvise splints, but a note on improvised splints: if you take like a sharp pokey stick and tie it to somebody's ankle to try and keep their break still, it's really going to hurt them and it's not going to be an effective splint. So you can improvise, but you you need to put a little bit of effort into making sure that it's not also causing them some pain. So what I'm going to use is what we call the RUS. RUS stands for really useful splint. I apologize for that pun. That's how we roll. This is a RUS that I have already formed to the right size and shape for the foot that I'm going to splint. But typically these come, this one is rolled up around a tensor bandage. And the idea behind these splints is that they're foldable metal and they're covered over by foam. So they're very comfortable next to the skin and you can form them into any shape you want. So I've got this one folded over already so that it's the right size for what I want. But I've taken the time to form it close to the body. So I've curved it into kind of like a C, and I'm going to use this like a stirrup. It's probably the best, most effective way to splint someone's foot. So I would slide their foot. Well, I would probably slide this onto their foot. I'd take some time to shape this. I'd take a look to see if there's any gaps around. I gotta say, it's really convenient to be able to pick up this foot and show you exactly what I want to show you. On a real person, I can't get them to bend in this way. I want to make sure there's no gaps between the splint and the foot. So right here, I've got a little bit of gap in there. So I could fold the splint up a little closer to the foot, maybe pinch it a little bit, or I could take something and pat it in there. Like if I had some gauze, not bloody gauze, I could push some gauze in there to take up that space between their foot and the splint so that the splint is touching the body everywhere. Then I'm going to wrap or tie this onto the foot. So you can use triangular bandages for this. You could improvise your ties with scarves and bandanas and buffs and extra t-shirts. I'm going to use a product we like called Coban. You might know it as vet wrap, especially if you have a dog or a horse. It's kind of like a tensor bandage. It's stretchy, but it's really thin, so it fits better underneath footwear. Not that this person's going to put their boot on and walk, but it does fit better that way. And it sticks to itself. So I can wrap with it and then just smooth it down and stick it to itself. You can reuse it if you remove it carefully. So in this case, I'm going to do pretty similar to what I did with the sprain, making sure that this fits well. I'm going to wrap it a couple of times really snugly around. Probably I'm going to wrap tighter than I think I need to instead of looser than I think I need to. And if I need to loosen this off, I will, but a splint needs to be pretty snug in order to work. And I'm going to continue with a figure 8, just like I did with the sprain. This time I started up at the ankle. You can start wherever you like on a fracture. And I'm going to get this wrapped nice and snug. This would be a great splint for something that was right down here in the ankle because I would immobilize the foot and I would immobilize the lower leg. If the fracture is higher up on the leg, I'm going to have to unfold this RUS and take it much higher on the leg, wrap maybe all the way up to the knee, maybe even above the knee, depending where the fracture is. And then I can cut this anywhere I want to, and it'll just stick to itself and close itself off, which is pretty cool. And it usually comes in awesome colors. So that's a basic splint. Couple of things to talk about here. These principles apply to whatever part of the body it is that you're trying to splint. You want to reduce the movement above and below where the fracture is. So figure out where the fracture is and make sure that your splint will do a good job of stopping it moving above it or below it. We've already checked for circulation before we started this splint. Once we finish, we want to check for circulation again. Make sure that our splinting didn't change their circulation. So look at the color and the warmth again, ask them how it feels, so that our splint does a really good job of keeping them solid in this, but it doesn't cut off too much circulation. The other things you want to think about, if you can, keep it nice and neat and tidy so that you know what to adjust when you have to adjust it. The fracture is probably going to swell over the next few hours, so we might need to loosen this off and allow the person a little bit more swelling room in there. But that's something we can do kind of an hour after we splint or maybe a couple hours after we splint. Make sure that the splint touches the body everywhere, so it's nice and snug. We've got it bound above and below, and then it's comfortable for the patient. If it's doing a good job of reducing their major movements, we've probably done a pretty good job of splinting it. There's a couple of products I use there. The RUS splint, there's other splints out on the market like the SAM splint and this Coban wrap that I use to wrap it on here. I could have used a tensor bandage or I could have used triangular bandage to tie on there as well. Okay, so fractures, our goal is to keep them stable, to keep them in line, and then to get this person out to get help. Obviously, they need to go and see a doctor to get this set properly and then casted, however that's going to happen. The products we use in the backcountry can really help us out with this. We don't have a lot of time to talk about first aid kits or gear, though that is something that you can spend a lot of time learning about. Certainly, if you take a first aid course, ask your instructor to show you their kit, ask them what they like to carry with them. If you're looking for more information on this right away, you could go to the Rocky Mountain Adventure Medicine website, which is adventuremed.ca, and we have kits. We actually have kits that we sell. We've put together for our students and for ourselves, and so all the kits on there are the kits that we personally carry, but you can see a list of the contents of what's in the kit, and that'd be a good starting point to think about. I've got my kit here. Don't be intimidated by this one. It's huge. This is not the one I take with me for like a little day trip or even like a quick overnight. This is the one that I use to stock out a smaller kit. It's got a ton of stuff in it. It folds out so that I can store a lot of things in here. And one of the things I like to do with my kits is keep things in little baggies inside the kit. So if I know I just need a good wound care bag because I'm going on a quick trail run or a little hike, the risk isn't really high to that trip, I can grab a quick wound care bag. And if I had something like this, plus if I thought my risk was a little bit greater, a splint wrapped around a tensor bandage, had these two things together, I could probably handle quite a lot of what I'm going to run into. So I always modify my kits for the activity I'm doing, what the risk is like, how many people I'm traveling with. It goes back to that pre-trip planning thing we were talking about before, where if I think through the types of injuries that I'm likely to get and I carry the gear that's appropriate to those, I'll be more likely to be prepared. And honestly, if you have the world's best first aid kit, but it's this big and heavy, it might sit in your car and then it's not very helpful to you on the trail. So it needs to be versatile, it needs to be light enough, it needs to be practical enough that you're actually going to use it. So that brings us to the end of our presentation. Obviously, there's loads more we can talk about, and I really encourage you to continue this learning. Find a good wilderness first aid course. It's actually really fun, especially if you can take it with friends or coworkers or the people you travel with. You'll learn a lot about each other. You'll learn how to look after each other and keep each other safe. And it gives you a lot of really good critical thinking skills, which is useful to you in all kinds of areas of your life. And it'll make you feel a lot more confident to get out there on the trail. So I wish you many great adventures, especially now that we're opening up and everyone can get out and try to enjoy some safe recreation. I hope you don't need to use any of this information except maybe the planning bits. Thank you very much. Bye, everyone.
That's it for our virtual adventure safety tour. Thank you everyone for joining us. A huge thank you to our partners Mammut for your ongoing support and dedication to getting women into the outdoors. See you all at our next virtual event series. Bye!